Kenya has heightened its surveillance along its borders with Uganda and has been investigating a suspected Ebola case. A 32-year-old man from the western part of Kenya had traveled to Uganda in early September. According to a statement from the Ministry of Health in Kakamega County, the man doesn't show symptoms of the disease. Uganda is trying to contain an Ebola outbreak declared 10 days ago, although the first confirmed infection was last month. The country has officially reported 6 deaths out of 31 infections, but the death toll could be higher. President Yoweri Museveni on Wednesday ruled out a lockdown, saying the country has the capacity to contain the outbreak. Well, for more on the Ebola situation in Uganda, we are joined by Luca Saraceno. She is the Regional Public Health Officer and Emergencies Coordinator at the International Federation of Red Cross and the Red Crescent. Welcome to the program. Let me begin by asking you about the fact that they have not been able to narrow down on the patient zero. How worrying is this?
Well, thank you very much. In fact, the first case, the epidemic was declared the 20th of this month, but it was quite evident from the beginning that some suspicious deaths had occurred in the community some days earlier. And for example, one nurse died in a local clinic the 16th. So it is worrying in the sense that means that obviously chains of transmissions had started earlier. But I have to say that at the moment there is a ramping up in the response, and which means that all those cases as well, all those deaths, those suspicious deaths, have been accounted for, and it has been started what is called the contact tracing. So the health partners, including the Ugandan Red Cross and the Ministry of Health and other partners, are making sure to identify all contacts that had contact with both the current cases, the current deaths, the ones that have occurred since the beginning of the outbreak, and also the ones that have been identified and have been classified as suspect deaths. So all these individuals are being identified, are being traced, and now they are trying to make sure to follow up on them so that in case they exhibit symptoms, then they can be transferred to an Ebola treatment center, an Ebola treatment unit. So it is worrying in the sense that, of course, there have been cases that occurred in the community earlier than when the outbreak was announced and was notified, was identified. But we are making sure also as IFRC and supporting the National Society of Ugandan Red Cross that contact tracing and community-based surveillance to identify suspected cases is being ramped up. This is one of the key interventions in these kind of outbreaks.
All right, Luca, you mentioned ramping up in response. Could you expand on that and tell us more about the ongoing efforts to curb the outbreak? And most importantly, can you talk to us about what key challenges you have been facing?
Well, the type of intervention that typically needs to be implemented in these cases is, first of all, as I mentioned, contact tracing and community-based surveillance. So basically making sure that we can identify the contacts of suspected and confirmed cases, and that we have teams in the community that can identify whether there are individuals who respond to a community case definition of Ebola. And that's one of the components. And for example, the Ugandan Red Cross is training currently 4 teams that are going to be deployed in the affected districts. We have already one team that was already previously trained based in Kampala. This was immediately deployed in the area so that this team can immediately be activated and can support in this important exercise. The second critical component is on what is called safer and dignified burials. The individuals who die out of Ebola are extremely infectious, and the practice of burials can be a very important vehicle and very risky vehicle for transmitting the virus between the individual who died and the community and family members. So it's extremely important that these burials are dignified in the sense that they need to respect the traditions and customs, and of course also the sense of loss of the community and families, but needs to be safe. So there are trained teams that are going to do that. So we are training we're supporting the Ugandan Red Cross, which is the lead in this type of intervention, as in general is the Red Cross across the world. The Ugandan Red Cross is training 4 teams, and we are supporting on that. There was already one team already trained, again in Kampala. This has immediately been deployed with vehicles and supplies to start this critical exercise, because the more obviously also bodies may remain not buried, the more there is also the risk of infection among for example, staff or family members. So this is another critical intervention, and we are also making sure that supplies are being deployed to Uganda. So, for example, we have activated our warehouse in Goma, in the Democratic Republic of Congo, where since it's a country where there are very often Ebola outbreaks, we had a very large stock of kits for safe, dignified burial, and they are being transported rapidly to Uganda so that they can be deployed and used by these teams. So this is another action that is being ramped up to respond. A third action that is being done by the Ugandan Red Cross is the support for the transportation of Ebola suspect patients, or individuals who exhibit symptoms among those that are being traced, the contacts, or even identified within the community as part of this operation of community-based surveillance. So the Ugandan Red Cross has deployed 5 ambulances that are transporting patients to the Ebola treatment center, and then there they will undergo screening, and in case they will be, they will also undergo the necessary treatment for making sure that they can survive the virus. So the treatment in this case is mostly for maintaining the homeostasis, so the vital function of the individual while the individual fights off the virus. In general, the key message that needs to be transmitted is it's very important to access healthcare, because accessing healthcare promptly increases dramatically the chances of survival. And this is maybe one of the challenges that there is in this outbreak, and in general in all the Ebola outbreaks, both of the Sudan strain or the Zaire strain, the one that is more common in DRC. And it's that there is a fear in the community. There is a lack of sufficient knowledge in the community about the virus, about how it's transmitted, about the importance of accessing promptly healthcare.
All
And
right.
that's the reason why some of the interventions, critical interventions, focus on what is called risk communication and community engagement. There are teams that are being trained. There is material that has been deployed and provided so that the communities are aware of both the virus, of its characteristics, of the disease characteristic, and of the importance of accessing healthcare.
All right.
So in general, there is a ramping up of the support, and it's both the Red Cross, the IFRC, the Ministry of Health, and the government, and a large number of partners that are working together to contain this in Uganda.
All